So the major challenges right now in Zika research and coming up with public health solutions are that we don't have good diagnostics because we cannot distinguish easily infection with Zika virus from infection with dengue virus or related viruses that are of the same type. The diagnosis is complicated. The genetic tests, which are primarily based on polymerase chain reaction, are very accurate and very straightforward. But the antibody tests, which are the ones that we need to use to look at whether or not a woman has been exposed to Zika, even if we cannot yet find it in her bloodstream, right? We can't find the Zika virus itself. We may still find antibodies indicating that she has been exposed. And this exposure, even if we can't detect the virus anymore, poses a significant risk to the unborn child. We don't yet have any drugs which are helpful, and frequently we only make the diagnosis after the damage is done. So the shift should be to understanding what kinds of vaccines might be useful. And this is challenging too, because there's evidence to suggest that with some flavivirus infections, if you get exposed to one virus and then you see another virus, the damage can be even more severe. And that's because antibodies that are directed against the Zika virus, instead of actually neutralizing the virus and killing the virus, may help it get into cells where it causes damage. So the vaccines that we develop for Zika virus have to be very specific, and they have to be perfect. They have to actually prevent infection. We don't yet know, unless we study prospectively, what the actual risk is with a woman who's pregnant, who gets exposed in the first third of pregnancy, the second third of pregnancy, and what the risks are to children. We focus really on the impact on the unborn fetus, but there may be things that we see in young children too. The most obvious sign of disease that we've seen so far has been small heads, microcephaly. But I would not be surprised if we didn't see autism, attention deficit hyperactivity disorder, schizophrenia, other kinds of problems that are less readily appreciated than the microcephaly.